Very full presentation, town hall for you today. So we'll go ahead and get started as people are still coming into the waiting room. We're getting them into the presentation. So we'll get started. And I would like to welcome you all. I am Tanya Hitchman, Director of Community Programs at ALS Texas. We will be recording this town hall presentation today and sending it out afterwards. So everything that's covered today, you'll be able to hear and see again. If you've got questions during the presentation, y'all are pros at this. You've seen it done before. You've been on so many of our workshops and presentations. If you've got questions, put them in the chat box. This is interactive. We want to share all of the great things our ALS Texas community is doing, and we want to hear from you, your thoughts, your questions. So use that chat box, and we'll have some time throughout the presentation to address those. I'd like to thank everyone for joining us today. We have so many people joining in from throughout the state and our big community. We're so glad that you took time out to join us today. We'd like to especially thank our ALS community. Community is the word you're going to hear today. It's about community. People living with ALS, caregivers, families, our supporters, donors, healthcare professionals. Without your support, all of you, none of this is possible. It just isn't. We have seen in the last year so many changes. We could have a presentation just about the changes, right? But ALS doesn't stop. But guess what? Neither will we. And now Tanner Hawkinsmith, our Executive Director at ALS Association of Texas, is going to talk to you more about our mission and how we've adapted during these unprecedented times. Tanner?
Yes, hello. It is wonderful to virtually meet everybody again. It's always my privilege to be able to talk and communicate with the ALS community, especially here in Texas. You guys have grown to be something that's really special to my and my family's heart, and we love nothing more but to serve people with ALS in the state of Texas and their whole network. So thank you guys for the opportunity to serve you and to serve the ALS community. And just a big thank you. Throughout 2020, I could not believe the amount of support, both from our patient community, our volunteers, and our donors. And so we couldn't have done any of this without you. And so thank you. Many of you guys know who we are and what we do as an organization, but just a quick overview. The ALS Association is a nonprofit that's completely dedicated to fighting ALS. And we don't just fight ALS on one front, but we cover all the bases in research, patient, community services, public education, and advocacy. And really, at the end of the day, want to provide hope, support to those facing this disease. But at the end of the day, our vision is big, and it's to create a world without ALS. And so we do this many different ways, but something that's just foundational to who we are and our one most important guiding principle is that people with ALS and their families come first. We always want that to guide every decision that we make in our organization, from our leadership team to our board of directors, to our staff, to our volunteers. Everything that we do is focused in on people with ALS, and they come first. And it's really because of you guys that we're being able to do this and serving more Texans than we ever have before. And so if we look at what we did over the course of this year, in 2020, as just an update, we served more Texans with ALS than we have ever before, over 1,200 people living with this disease. And so it was our honor to serve all of those. We expanded and continue to operate and help support our 11 multidisciplinary clinics throughout the state of Texas, including in our rural communities. Even throughout COVID, we saw over 650 unique visits to our clinics throughout the state of Texas. And amazingly, we were still able to help support our clinics that conducted 18 clinical trials throughout the state of Texas. Some other things that are really important is obviously durable medical equipment, which we'll talk a lot about later today, is still a foundational piece of what we're able to do, providing hope through allowing people to still be mobile and have some freedom in their lives when they're living with ALS. And so we're able to donate over $1.4 million worth of equipment throughout the state of Texas. And then something that we of course had to adjust and look at how we provided service. But we provided over 160 different virtual workshops and presentations and support groups for patients and family throughout 2020. And so it was our honor to be able to change and adapt what we did throughout this. But at the end of the day, to go into it, we just had to think big and innovate during this time. The one thing that we knew we couldn't pull back on was serving people with ALS. And so our mantra during the time was to adapt and never cancel, to continue to push forward in what we're able to provide to those with ALS, to learn and to guide. And so we can still provide these services. And we learned a lot during 2020. We'll talk a little bit about how later on in the presentation about how what we learned in 2020 we're carrying over into the core part of our mission. But overall, I want to look at the three areas that we focus in on. So first, we're going to talk about look very quickly about research. So our goal, obviously, is to support crucial research for treatments and trials around the world. And so, at the ALS Association, our mantra there is "The world is our lab." The ALS Association is the largest private funder of ALS research worldwide. Currently, we have 169 active research projects, and some of which are in our own backyard. And so we're able to continue to still push those forward. Just two quick highlights for this past year in research is obviously one of the things that has really brought the ALS research community together is the Healy ALS platform trial. And this is something that we have 3 of our clinics here in Texas very actively a part of at Texas Neurology in Dallas, Houston Methodist in Houston, and UT Health in San Antonio. And so this is something that's going to enable researchers to study 3 proposed drug treatments at once. The hope is after this platform trial, we'll be able to exponentially rapidly decrease the amount of time it takes from a research and a treatment to get actually to patients. So our hope with the Healy platform trials that accelerates our search at effective treatments and a cure. The next one I want to highlight is something that we've been funding for several years now. And this is the T-REX study at Houston Methodist led by Stanley Appel. This is now in multiple sites across the U.S. It's currently in the phase 2, but this has shown real promise into slowing and even stopping progression, hopefully, with people with ALS. And currently, right now, we've funded along with partnership funding through MDA, Finding a Cure. And so with the ALS Association, we've been able to provide over $3 million worth of funding. And a big chunk of that, over $1 million of that funding came just in March of this year to continue the phase 2 of that clinical trial. So when we do things like raise money for research, some of this is landing right back in our backyard in the state of Texas, where we can continue to push forward, finding a cure right here in our state. And coming up, we are actually going to have more in-depth discussions about research. And so I know a lot of people most likely have questions, and they're most likely really great questions. We want to dedicate a time to really discuss research both on the clinical front and on the research front. And so we're going to have 2 different times. The clinic panel discussion that's going to come up in the summer will be clinicians from the state of Texas. Now, that won't just be about research. We will address clinical trials most likely within our clinic system at that panel discussion. We'll also talk about overall care at our clinics and things of that nature. But then we'll take an in-depth look at our research program and have some researchers and also some nationally staffed research people as well to come have a panel discussion and really much a larger open discussion about our research program and really where research is at, whether we're funding it or something that's happening outside the ALS Association. We're going to focus in on research across the board at a panel that we're going to have in the fall. So look for that to come down and invite to be sent out about those times. The next is advocacy. This is something that really we focus on different areas in advocacy. In the ALS Association, we look at quality of life legislation, what type of legislative priorities can we push forward that will help everyday life. And then we also look at how can we generate more funding through the federal government to push research forward. And so our public policy and advocacy looked a lot different this year. Obviously, we did virtual visits and we were able to meet with, I think, over 25 of our reps throughout the state of Texas, and people with ALS were able to tell their stories and really push forward our agenda even during 2020. This year is going to look the same, as we're not going to have an in-person advocacy day or in-person meetings on Capitol Hill in DC this year, but we still will continue to push those things virtually. But we're finding that they're still very productive times. We end up getting more time with our representative staff and really push forward. And so even during 2020, we were able to push a lot of things across the finish line. So as we talk about this, we look as three big wins that we had in 2020 is one of the first big thing is non-invasive ventilators were removed from competitive bidding. And if you don't know what this is a huge deal. And we can, if you have questions about this, we can talk about this offline. But if non-invasive ventilators were put into competitive bidding, it would very much hinder the type of equipment, the type of care you can receive and being reimbursed through Medicare. And so we know that people with ALS need the best respiratory care possible. And so this really prevented that from happening and us being able to continue to still provide great care for respiratory needs. Second was the ALS Disability Insurance Act was passed. This is a huge deal. This is something we've been fighting for years, and a lot of other ALS groups joined onto us in this final push. But we've now got that removed, so there is no waiting period for Social Security and disability benefits. You're able to receive those now immediately. And so that's a big win. That happened. This has happened years after we were able to do the same thing through the get the 24-month Medicare wait time taken away many years ago. And so this is just another step in quality of life. And then number three, the big win is we were able to increase funding to $40 million, which is double the amount of funding we received from the previous year for the Department of Defense and our research project. And so that's a big win. We were able to continually increase the amount of funding that comes from the federal government for critical research that we see happening across the United States. Looking at the 2021 advocacy priorities, you'll see a lot more about these in the upcoming weeks as we look forward to our time with our representatives in June. The first is we're looking to accelerate development and approval of access to effective new treatments. That's a focus of ours. We want to increase federal funding for research. We're actually asking again to increase that to over $60 million. This is something that came through 2020 and through the pandemic is obviously people with ALS have needed greater access to telehealth way before the pandemic. And the pandemic was able to highlight really across the board the need for people to access telehealth. And so we want to extend this access to telehealth for people living with the disease outside of a pandemic, and this to become a normal thing for people with ALS. We also want to provide high quality, affordable access to healthcare. And again, we want to increase veteran benefits for people with ALS and their families. And so look at those specific priorities to come out soon. Let's dive in. We're going to dive in really quickly into local care. So our goal is always to serve as a source of support for Texans and their families. And like I said before, during COVID, we really wanted to make sure that we we didn't cancel our activities. We wanted to maintain that regular schedule activities. We wanted to increase the amount of support and information we were able to provide. And this is something that we really focused hard on. And so looking into that and serving the needs of our community, we adapted and created new programs. Something that our staff had been building towards, and Tanya, who you've heard from, had been building a platform for, was to increase our ability to serve the entire network of the person living with the disease. And also so we could provide a higher quality of care as the disease progresses. And so some new programs that came out of 2020 were our launch of our youth and children's programming and our caregiving program. And you see on the picture of that, the family talks is some amazing time where we're able to really talk to youth and children about what ALS is, begin to take some of those fears away in an open discussion, and really begin to look at our youth and our children as secondary caregivers in the homes, whether it's a grandparent or a parent. And so something exciting that came out of 2020 is to be able to really step in and do a lot of these programs that we had been planning on doing for years. And then also we were able to stay connected from afar. We implemented new virtual support groups, interactive groups, and a lot of educational workshops talking about whether it's respiratory care or bringing in other disciplines from our clinics, bringing those disciplines to you, and providing more ongoing training for our caregivers. So that was very exciting for us to be able to do that during 2020. And overall, we really just wanted to make sure that we kept the ALS community connected and be a source of that connection. And we discovered that virtual support groups are not only keeping our regular attendees connected, but we're also enabling other people with ALS and their families to join from more remote areas in the state. we always struggled with some of our remote communities providing more information and education, because maybe we didn't have staff or have the ability to have enough of a size to create a support group or have the ability to get that done. And this really provided us the ability to provide that service and more ongoing education to our more remote and rural communities. And so that was very exciting to see people connecting from around the state in areas that we hadn't been able to connect with prior. And so that's something you'll see as we look at our 2021 priorities going forward, something that we learn and it's valuable that the ALS community needs, and we're able to provide that. And that's something that's going to become a foundational piece of how we serve people with ALS in Texas. And so looking at our 2021 priorities, we're going to continue to build and expand our youth and children's programming and our caregiving program. We are going to expand and build upon our Navigating ALS series. That is something to where when you're diagnosed and throughout the progression, you can log on at different times and receive more information about where you're at in the progression of the disease. Number 3 is we want our clinic expansion and advancing certifications for existing clinics. This is a big deal. We know that people who attend one of our multidisciplinary clinics not only have a higher quality of life, but an extension of life as well. And so our goal is to provide clinic access to everyone in the state of Texas. And so we've had some real wins in the past years with that, helping establish clinics in El Paso and the Rio Grande Valley. One big area of focus of ours right now is to get a clinic going in the Panhandle. And so we're looking at and building some business plans and looking at potential partnerships to make that happen, to provide that clinic access in that area of Texas. We are also going to continue to focus on building our virtual workshops, presentations, and support groups. And then our goal is to always serve more Texans with ALS and their families than we ever have before. And so we want to continue to serve more people and expand that. And so looking forward to 2021 and what we're going to be able to provide. And really, again, as I started this, we couldn't have done this any of this without you. Regardless of how you interact with the organization, it's either because of you that we're able to do these things. And what's amazing is throughout the United States, we saw a lot of nonprofits suffer and not be able to bring in the income necessary to continue their programming. But because of you, we're able to raise the funds needed to support Texans with ALS and their families during a very challenging time. Families and caregivers received the support and resources they needed. We were still able to provide medical equipment being loaned out to families and who needed alleviating their financial burden. It was amazing. We were able to hear these youth sharing their stories and finding strength in their shared experience online. Our ALS clinics will still continue to deliver specialized care and conducting clinical trials and with hopeful new treatments on the horizon. And at the end of the day, our Texas chapter event successfully raised critical funds while moving to socially distanced and virtual fundraisers. And our Walk to Defeat ALS at Home brought Texans together across the state, allowing us to gather safely from afar. And so even throughout all of this, we were able to still bring in the finances necessary to continue to not only sustain our mission, but grow our mission and serve more people and push forward in the advancements for treatment. And so we were able to do that. And it's really exciting that we're able to continue to provide that for people with ALS in the state of Texas. And really, it's because of you. And so as together as a community, we continue to hope that we create a world without ALS together. And so, my apologies. Again, it's my honor as to serve as the executive director, and it's my honor to serve for the team and to serve the great state of Texas and the ALS family here. So that's my presentation. I know that you guys, I went really fast and covered a lot of material. But wanted to give you guys, and this is going to be wrapped up here in the future in a very nice yearly impact report, so you guys can see the impact we've made and see this material. But as you may have listened, if you're listening to me, you may have developed some questions, and so I'm going to pass it over to Tanya if we had any questions come in or comments that need to be addressed. Or if you have any now, please message them in. I'm happy to answer all that I can.
Thank you, Tanner. And as we mentioned at the beginning, this presentation is being recorded, so you'll get this sent out to you afterwards. So all of the information that Tanner covered and that we will cover, you'll be able to go back and hear on your own schedule and on your own time. So don't worry if you missed parts of that. We do have some time for a couple of questions. And throughout this presentation, we'll get to as many as we possibly can. Know that if we don't get to your question on the presentation, We'll follow up with you by email to address the question and make sure that you get an answer. Okay, everyone? So feel free if you have any questions. And if you don't have any questions, because Tanner covered a lot of information, don't worry. You can type those in throughout the presentation, and we'll move on throughout the program. All right. As Tanner mentioned, one of the most impactful programs of our ALS community is our equipment loan program. Many, if not most of you, are probably familiar with the equipment loan program, but do you know the man behind the equipment loan program? Today, we're going to make sure that you do get a chance to know Marshall a little bit more. Our equipment loan program enables those living with ALS to get free access to vital equipment. This equipment ranges from bed rails, shower chairs, rollators, all the way up to hospital beds and power wheelchairs. This past year, as Tanner mentioned, we were able to loan out $1.4 million worth of loaned equipment. 1.4 million, y'all. This alleviated a significant financial burden for our families in our ALS community, but we didn't do it alone. We couldn't do it alone. Our partners help us identify the needs in the home, going above and beyond what maybe their stated mission is, to ensure that Texans living with ALS have all the resources they need. Right now, I'd like to introduce you to Jennifer Beckett, our ALS Director of Care Services, to Marshall Nelson, again, the man behind the equipment loan program. He is our ALS Texas Equipment Loan Manager, and Pablo Quijas with RQS, and Antoinette Verdone, founder of Improvability. This panel is going to share with you how we all work together to serve our ALS community. Again, if you'll type questions that you have in the chat box, we should have some time at the end of this panel discussion to address those questions. So feel free to do that. And I'd like to start out with Marshall. Again, Marshall, probably everybody knows that ALS Texas has an equipment loan program. They don't know that you're the man to email or call if they have items they'd like to donate, items they need us to pick up, or they need something delivered. And so you are the man, if you will, behind the Oz curtain that we'd like for people to get to know you a little bit more today. Can you tell us about the equipment loan program?
I can, Tanya. I think you basically stole my whole speech about everything I do. So and I try not to hide behind a curtain, but you know, some days maybe I need to. I wanted to start out. I had someone ask me a question this past weekend, actually, as to why I do this. It was someone that didn't know who I worked for, didn't know what I did, and everyone I work with knows my mother had ALS. She died in 2003. It's been quite a long time ago. Things have changed drastically in that 18 years. But for me, this is a mission every day. And the kinds of programs, our equipment program that we have now, was not available then. And so it's really an honor for me to work with all of you. And I'm glad to be here today. Just to briefly tell you kind of how our program works. You know, we do our best to provide all kinds of durable medical equipment to our ALS patients around the state of Texas. And we do this at no cost to you, and also there is no time limit. When we loan you a piece of equipment, you are welcome to use it as long as you need it, and those two things are not going to change. So this obviously helps alleviate a big financial burden on a lot of our families. So all of you know how costly many of these pieces of equipment are, and so this is one way that we can help in that respect. I can kind of tell you how our program works. I've kind of listed it out as kind of threefold. We have several medical equipment companies that we work with around the state that we work with on a fee-for-service basis. And what these companies do is they pick up and they deliver and they store the equipment for us. And primarily this is the I guess what I would call the big ticket items, the large items: power wheelchairs, hospital beds, patient lifts, the big fancy rolling shower chairs. Those are really good examples. The kinds of things that's not easy. I can't move those around for you in the back of my little Ford Fusion. So we need help with those kinds of things. Another area is, and you'll get to visit in a minute with Pablo from RQS and Antoinette from Improvability. They help us provide some items, like for RQS, it's respiratory items like suction machines, cough assist devices. For Antoinette, it's various communication devices. They do those things for us free of charge. Which is an incredible service to the ALS Association. And then the third piece, and this is something we expanded greatly last year during when the pandemic hit, is there are many items, especially smaller items such as rollators, these overbed hospital trays, transport wheelchairs, smaller manual wheelchairs, bedside commodes. That's another good example. Those are things that we, generally speaking, just order from Amazon and just ship them directly to our patients and their families. One of the things prior to last year, a lot of those kinds of things, a lot of the times we could deliver them ourselves. I know Jennifer Beckett, that you'll listen to in a minute, she was my primary delivery source in Austin. So but we're not able to do as much of that because we weren't doing face-to-face visits mostly. So that's primarily the way we handle getting equipment to you.
And Marshall, I think you touched on something really important that I don't want us to miss. And this is true for everybody that's on this call today and that we'll hear from. This is personal for you. You are a tremendous resource because you've had personal experience with ALS. When our community reaches out to you, you know the right questions to ask. Height, weight, you need a transport chair, let me find out this. What does your house look like? You're a tremendous resource that I want our community to know that they could reach out to you for those questions. And you also touched on something that I think is really important as well. You mentioned that there's some fees for storage that we have for the equipment. And the equipment program everyone has free access to that in our community. But I remember as a little girl, I remember somebody had a free puppy. And I told my dad, I said, look, it's free. It doesn't cost anything. Can we get it? And he said, nothing is free. And so it's free to our community, but we do have, and through generous donors and sponsors and our entire community, we're able to cover some of those fees, right?
That's absolutely correct, Tanya. And Tanner hit on that a little earlier, but it is because of everyone like you that's on this forum today. That any contributions to us greatly assist our equipment program. And we, again, Tanner alluded to the fact that we had a very successful fundraising year last year. And so we're able to do more this year than we did last year. And we hope to continue that every year to be able to do more each year. But it's on the generosity of so many others that we're able to do this.
Absolutely. And you highlighted that during a crazy year, a pandemic, how we utilized Amazon to help get things, right to the doorstep when we weren't having any contact. How we went around and over the walls to make sure that our community had what they needed to the best of our ability. If it was possible, we were going to make it happen. And a big part of that was relying on community partners. There's that word again, everyone, community. Relying on our community partners to house and sometimes help deliver that equipment. It's through the support of those partners that we were able to get equipment to people who needed it. And so with that, I'd like to move to Antoinette. Improvability is one of those amazing community partners that we have. They house communication devices for us. Antoinette, can you tell us a little bit more about Improvability?
Yeah, so Improvability is a full service assistive technology company. We provide, it's hard to list out all the things, but pretty much anything stuff related for people with disabilities, we can help with that. One of the big areas that we do working with ALS is communication devices. And as Tanya and Marshall said, we do house the ALS Association equipment at our location in Austin, Texas, but we do cover the entire state. So we moved into a new office space in September of 2020, and is that right? Yeah, in September. And so we did actually have it at our physical location, but now the loan closet has grown, we've grown, so we now have it in a storage facility that we keep everything in. So as we get donations in, we clean them up, wipe them out, make sure it's kind of like as brand new of a device as we can make it, sanitize it, and then it goes into the storage facility until someone needs it. And we also do AAC device. We are a company that you can get a communication device from, and a lot of times when we're doing demonstrations, we'll actually bring a loaner device with us, so that someone, as soon as we meet them, they're not without a device.
Thank you. And so you moved during a pandemic too then, right? Okay. So yeah. Nobody's going to expect you to remember the month because 2020 is a blur. It was just one big month. So don't worry about that. But you had a lot going on, and yet Improvability stepped up to help ALS Texas and to help our community. And we're very grateful for that. You allowed our community to stay connected, to communicate and have a social connection when everything was so distanced, and you helped made that happen, and we're very thankful for that. Thank you. Marshall mentioned the challenges during this past year, and now I'd like for us to be able to hear from Jennifer on how our team, our ALS Texas team, typically identifies the needs within our community to begin with. Jennifer?
You're muted.
All righty. So thank you, Tanya, and thanks everyone for joining us. So pre-COVID, when a family reached out to connect, if wanted, we'd set up a time to visit in their home. We see things through a different lens. The moment we arrive, we take in potential challenges and possible future needs. The ALS Clinic team provides much the same. They assess each individual, where they are, where they may be headed, and navigates with them through education, trying to keep everyone a few steps ahead. Together with the team, we try to take away as much of the guesswork as possible. COVID took away these opportunities. If you've met me, you've most likely heard me say that we here at ALS Texas are here so you don't have to reinvent the wheel. When COVID hit, we found ourselves trying to reinvent the wheel on how we were going to stay connected to our families and continue to serve in a meaningful way. There's much to learn on this journey. What equipment, the right equipment, and when is huge. So while we were reinventing, our partners in the field were still in the field. We have always worked together as a team, but now they became our boots on the ground. Improvability and RQS reached out and said, we can do more. We want to do more. They identified needs and reported back to us so we could continue to do what we do. Another phrase I say often, this is a club you don't want to be in, but you won't be alone. This is a perfect example. I'm grateful to be part of such an awesome group. So.
Thank you, Jennifer. And I love how you touched on when the pandemic hit, everybody stepped up and said, how can we help? If things changed, everyone was willing to pivot. And that's that power of community. You can't do it alone. And in Texas, we have a Texas-sized, Texas-strong community. And I'd like to visit with Pablo now to tell us a little bit more about RQS and how they're serving our ALS Texas community.
Hello, everyone. Well, through RQS, we provide ventilatory support, like Marshall stated. We provide them with a ventilator, cough assist to keep their lungs clear, and also a suction machine to keep their mouths clear. But our roles don't end there. Usually, we become a multidisciplinary team all rolled into one burrito. And so like one of our leaders here in RQSS, Fernando, you know, we're nosy. We're going to be there at your house. We're going to be very nosy in a good way so that we are able to provide as a community the things that the patients need. One of the ways that we are able to identify the needs is by asking direct questions. For example, you know, if you ask someone, how are you feeling today? They're just going to say, oh, well, fine for the most part. And that ends that conversation. But when we're there doing our assessments, going through our event stuff, we ask very direct questions. How's your walking been for the last month? When you walk, have you noticed if you're sliding your feet? Can you lift your foot and does it stay like this or does it hang? Are you dropping your spoon, your fork when you're eating? How long is it taking you to eat? Have you noticed those things? If not, pay attention from this month forward to see where you land. Or in the shower, after your shower, are you exhausted? And why? And what areas? Is it your legs, your hands, your arms? What gets you tired in the shower? Are you using a shower chair most of the time? You know, no. And so then that allows me to collect data, or allows us in RQS to collect the data that we need so that we can reach out to Marshall, reach out to Jennifer and say, hey, how can we help? Or we contact the physicians. I think we need to get PT involved, or OT or speech. These patients may require more than just what we're there for. And so that's how we work together. I know in RQS it's something that we strive to do, be more than RTs, because what we realize is that sometimes we are the only ones out there looking, visiting them face to face. So that's what we do.
Absolutely. And Pablo, you nailed it. We are all forming this multidisciplinary team outside of clinic, right? So our community doesn't have to wait if they're going to a clinic every 3 months to get eyes on them, to have a community that's supporting them. And you nailed it in that it's not like, oh, my job is just respiratory. My job is just assistive communication. We are all in constant contact. When y'all go out to the home, you're calling us and saying, here's what I've noticed. So when we say to our community, and I'm sure you've heard us all say this, if we don't have the right answer, if we don't have a possible solution, we'll connect you to who does. That's this in action right here. This is how the community works together. So thank you, Pablo. It's so important to know that we're all in communication together too, to support the community. We do have a couple of questions. Marshall, I think the first one will be for you. And it was, what piece of equipment do we find that is in the shortest supply and that we have kind of the most requests for?
Good question. I think probably I get the most requests, for, again, I'm gonna kind of put it in categories. The big equipment, the most requests are power wheelchairs and patient lifts. If it's smaller equipment, the most requests are most likely rollators, the rolling walkers, and transport wheelchairs, which is a smaller wheelchair. That's probably the most common things that we do. Can you remind me of the whole question, Tanya? I'm sorry, I lost.
you answered it. It was what's
I'm
the
old.
most. No, you answered it. It's what do we get a lot of requests for, and what's usually in short supply.
Yeah, the short supply, that's the part of the question that varies. Now, the things that we order from Amazon, those are easy. They're almost always available on very short notice. The big items just varies from case to case, depending on what our demand has been. Most of the time, things like power wheelchairs and lifts we have in stock. Probably, in answer to that question, electric patient lifts are probably the hardest things to get sometimes. We usually have more manual lifts than we do electric lifts. So those are kind of at a premium when I can track down an electric lift.
Perfect. Thank you, Marshall. And this next question, I'll start with Pablo, but it also is for Antoinette, I think. Do you need prescriptions from the doctor to get equipment such as cough assist or communication devices?
We do, even though the equipment is donated, we can't just hand them out. We usually need a doctor's prescription to be able to give one of those out. But I mean, it's something that's not difficult to gain. I know our company has a good relationship with most of the physicians out there, and when they know that we pose a question, doctor, so-and-so patient requires a prescription for this device, we just so happen to have it available, and the donation from the ALS Association, and most of them have been very responsive to get those scripts into us fast.
Thank you, Pablo.
For communication devices, through the loan closet, no, there's no need for a doctor's prescription. But even to get funding in the state of Texas, most of the devices we supply are through the STAP program, which actually does not require a doctor's prescription, but it does require a speech therapist to certify the form. If you were to want to use medical insurance for funding, then you would need a prescription.
Okay, thank you, Antoinette. Very helpful, y'all. Thank you. And the last question that we'll take during this time, again, if we don't get to your question, we will follow up with you in an email to make sure that you have the answer and information that you need, all right? Marshall, this one I'll throw to you as well. How long does it take once you receive a request to process that for equipment delivery or pickup?
Again, that varies, Tanya, but in the agreement we have with the medical equipment companies, we have some guidelines as to, and it's essentially based on the distance from the storage location to the patient's home or wherever they live. But I think in general, I can say that we try to get these big pieces of equipment delivered within a couple of weeks. There are occasions probably where that can't happen. And because I know I get emails periodically, I haven't heard, or what's going on, and so part of my job is just prodding the equipment company some, just to kind of get the process moving. So.
All right, thank you, Marshall. And y'all, we have time for another question or two, and I'd like to go back to some that we got earlier for Tanner. Tanner, so we're going to kind of go back to what you covered. What's the biggest unmet need that is either not addressed by the ALS Association, or is perhaps an area that we need to give more attention to?
That's a great question, and I think it's a hard one to answer as far as identifying the single biggest unmet need. Obviously, I think the biggest unmet need we have right now in the ALS community is we don't have an effective treatment. And so if we look at that, I think, the ALS Association with all of its other ALS organizational partners are tackling that a lot more aggressively than we ever have before. And because of the funding that we're able to receive over the past 5 or 6 years, has increased our ability to branch out and do more of that. And so if I can narrow it down, most likely in the state of Texas, and where we look at as far as like service is concerned and access, really the biggest unmet need for us right now is access to high quality clinical care. And I think, and that's twofold. That's not just for care purposes, but it's also access to clinical trials and more research happening. All of our certified centers of excellence are required to administer clinical trials or be doing some type of research. And so, really clinic expansion is a huge unmet need in the state. And there's a lot of areas, and it's not just in our rural communities, like I talked about in the Panhandle. We need to establish a clinic there, but also creating even more options in our larger cities that are some of our clinics are getting kind of past their carrying capacity. So how can we invest and help them grow their ability to serve more people and see more people at our clinics? And so I would say, for me, the biggest unmet need is really access to quality, consistent care in the clinic environment, regardless of where you live and who you are. So that's my opinion, but that's the answer to that question.
Okay, thank you, Tanner. Let's see. Let's do one more, if you don't mind. Yeah, and let's see. Who's driving the conversation around establishing a standard of care for ALS patients? Despite its past, the VA has seemingly set the bar.
Yeah, and I think you know, even with the VA, I think it's going to be a which VA are you attending situation with as far as the quality of care that you're receiving. And I think just in full transparency, I think that's been with the ALS Care Network as well. And I think some of you have probably experienced that. If you lived in a rural community, or if you've been in a different, maybe moved from a different state, and that chapter provided a different level of services than the chapter you're at now, or maybe less services. And so there's been that question highlights some inconsistency we've seen in ALS care. And so I will say that the ALS Association is really starting to take charge of that. And we're, for the first time, really collecting a lot of data about what services are provided, not just by the ALS Association, but across all ALS organizations, and identifying what are the core needs of ALS, and how can we begin to meet those needs? What are some core educational things that need to happen? When someone's diagnosed, what information do they need? What resources do they need? And so to answer that question, the ALS Association is driving that conversation, but it's not going to be without our partnerships of our DME companies, our clinicians, other ALS organizations that are also serving people. And so while we may be the catalyst for that conversation to happen, it's going to take a wider breadth of partnership to make that happen. And then you get into situations where every doctor also sees ALS care slightly differently. And so how can we get our clinic network, and that's where we'll do it a lot at the ALS organization, ALS Association, is how can we get our clinics to see some baseline ALS care in the same way? You know, and how do we prevent falls, and how do we educate people on preventing falls? How do we create an education thing where people understand to be more proactive than reactive when they look at their own ALS care? So there's a lot of things with that, but I would say that you'll see a lot more of that probably the next 12 to 24 months on there being some more consistent way we look at ALS care.
Fantastic. Thank you, Tanner. And great questions. Y'all, again, if we do not get to your question, we will follow up with an email so that we get you the answer, but keep those questions coming. This is interactive, and it's meant to be an engaging town hall with our community. I saw that someone typed in the chat box as well that Marshall is like Santa in having equipment delivered. And while that's true, and he does have a little bit of the beard, we are only able to make this incredible impact because of our generous donors and our amazing community partners like Improvability, like RQS, that are going above and beyond each and every day. We couldn't do our work without all of you, so we thank you. Thank you to our donors and to our partners. And thank you for joining us, Antoinette and Pablo and Jennifer and Marshall. We appreciate it. Now I'd like for us to be able to visit with an amazing couple to kind of tell us how Texans living with ALS are impacted by the equipment loan program. I'd like to introduce you to Dutch Root, who is boldly and courageously living with ALS, and his beautiful wife and caregiver. They joined us last year. If y'all remember, if you joined the town hall last year, just about a year ago, it was the middle of April, Dutch joined us last year. And so we're so excited to be able to visit with him again this year, and for you all to get to know them if you have not met them yet. Dutch, can you tell us a little bit about your story?
Yes, Dutch and I are happy. Can you hear us?
Yep, we're good.
Okay, great. Dutch and I are happy to have the chance to share our story with you. While this disease is life-changing, we're doing our best to adapt to it and to share what we are learning along the way. By the way, Dutch has written out this script. So we are also learning a tremendous amount from the greater ALS community. We are grateful to all of you for all your support. Within the last year or so, Dutch's voice has been dramatically impacted from his ALS. So he is now using a speech device. And so I'm just going to introduce that a little bit. He has put his narrative onto the device. So you're going to hear his voice. Go ahead.
Hello, everyone. This is Dutch. You are hearing a synthesized version of my voice. My current voice is difficult to understand. I can speak to you today as a result of a process called voice banking. I used software called Model Talker to preserve my voice from 1 year ago. You will hear more on voice banking later. Now, here's our story. I was diagnosed with late-onset ALS in October 2019. We will share with you what has changed since my diagnosis. We will touch on mobility, communication, breathing, nutrition, and swallowing.
Dutch is just going to introduce some of these topics, and then I'll give you some more details.
Thank you, Diane.
First, mobility. At diagnosis, I was walking with a slight limp in my left leg. I now move about, totally using my power wheelchair.
Like was previously mentioned, as far as equipment is concerned, you want to look at the long range, long-term goal. Marshall has been great in helping, and everybody has been really great in helping us try to stay one step ahead of what might be coming next. As far as mobility, walkers, rollators, wheelchairs, power chair, shower chair, commodes, all the things that Marshall was talking about and that Antoinette was talking about, we have needed. We didn't anticipate we were going to need things as quickly as we did, but we're really glad that we had the opportunity to get the equipment when we needed it, so it's helped a lot. Dutch initially started walking with the limp in his left leg, lost strength to the lower limbs, lots of muscle twitching, as others with ALS may have experienced. As he lost his balance, he transitioned to a rollator, and then after 3 significant falls, thankfully none resulting in a broken bone, but then it was on to the power wheelchair. So he relies on his power wheelchair. Transportation for those that have the ability to have a handicap accessible van, that's great, but we are using a transport agency, and that's worked well for us. We don't go anywhere because of COVID. So it's just to doctor appointments.
Communication and speech. A year and a half ago, my speech was normal except for some subtle changes. Today, most of my speech is not understandable.
Dutch was really wise, and it was through the prompting of a wonderful speech language pathologist that said, you don't know, none of us know if you're going to lose your voice with your ALS. So you may want to start voice banking, which Dutch did. He preserved his voice, and so that's really helped with his eye gaze tablet. He was able to use the software and convert it onto his laptop. He also uses his smartphone for communication and texting. He still has ability with his hands to do texting, so that's been great for us. As the deterioration and articulation continue to decline, and then also the air supply, because his diaphragm has been greatly impacted with the ALS. All of the equipment that we've been able to use with speech and communication has been fantastic.
Regarding breathing, before diagnosis, I noticed shortness of breath after walking a short distance. I was easily fatigued. Today I use a BiPAP ventilator 18 hours a day.
So Dutch is using the non-invasive ventilator. So it's the BiPAP or Trilogy. Some others may know it by those names. And without it, Dutch would not be here now. He's on the BiPAP about 18 hours a day currently, also relying on the suction machine and cough assist machine. So as mentioned earlier, all of these things are critical.
Yeah, a lot has changed in our world, and a lot changed for y'all in a year that had so many twists and turns.
Yep, it's been wild.
On nutrition and swallowing. When I was diagnosed, I could eat and drink whatever I wanted. I did exhibit frequent throat clearing. I attributed that to seasonal allergies. Today, all of my nutritional intake is through a feeding tube. I now drink only thickened water and coffee.
So again, thankfully with the feeding tube, and Dutch had that put in July of 2020 during all the COVID stuff, but we went in and he had that done, and didn't need it initially, wasn't dependent on it initially, but as the disease has progressed, it has become what he needs to sustain himself. So kind of where we are. We did a transition, soft foods, pureed foods, and now relying on the feeding tube, but that's kind of our story.
You know, y'all have been so transparent, and it's so critical to be proactive. You've mentioned that, you know, we don't know what's going to happen, but thinking ahead and being proactive, and just trying to stay one step ahead. So we thank you for your transparency and for sharing with others. Is there anything that you want to share before we go on to kind of wrapping things up and talking to Tanner?
I guess Dutch wanted to mention that we could not imagine our life without all the medical equipment that we've gotten through the Help with ALS Association. And if it wasn't for the loan closet and all of your help, our days would look very, very different. Order ahead. Dutch said, order ahead before you need it.
Absolutely. Thank you both so much. And you mentioned it, and thank you for saying you couldn't have gotten through this without the loan closet. And that comes from community, right? Collaborating with our partners. By collaborating with all of our partners, we can reach all of Texas. This community supports each other. Jennifer said earlier that it's a family you don't want to belong to, but once you're involved in it, we truly lock arms. All of us do, all of our partners, everybody that's involved in this community locks arms to support you all each and every day. We're connected, we talk, we communicate with each other. So if y'all have a need, share it with whomever you're talking to, whether it's RQS, Improvability, our team. Share that need so that we can then share it with the person that's going to get you fixed up. I'd like to ask Tanner to come back and talk about our equipment loan fundraiser that starts today, y'all. Tanner, can you tell us a little bit about that?
Yeah, and just real quick before we do, I just wanted to highlight the questions you guys sent in. We'll make sure not only do we just respond back to everybody about those, but we'll get them in an email so everybody can see the answers to those questions. So it's not just you seeing the answers to the question you might have asked. So again, Marshall, thank you so much, and the team and the whole panel and the Root family for coming, discussing, telling us your story and the impact that the equipment loan closet has and that program has to all people living with the disease. And so something happened several years ago. We had a caregiver whose wife passed of ALS, Frank Ildebrando out of Houston, and he wanted to create a legacy for his wife, and he knew how important the equipment was that they were able to provide for his wife, Barbara, as she went through the disease. And several years ago, he had started to make a financial commitment and created a fund within our organization, within our chapter called the Barbara Ildebrando Equipment Fund. And they have funded close to over several $100,000 to our program over the past several years. to ensure that people with ALS in Texas are able to receive that high level benefit of the equipment. And so to kick off our equipment loan program fundraiser for the month of May, he has donated an additional $5,000 to be up to $5,000 to be matched for any gift that comes in for our equipment loan program through the month of May. And so first and foremost, I want to say a big, huge thank you to the Ildebrando family, the children, and Frank for making this donation and allowing it to duplicate. And so as we kick it off today, every donation is that made specifically to our DME program, we'll follow up with an email about that. Will be matched up to $5,000. You can double that today. But also just talk to friends and family about people who might want to be able to give and help support this program. As you guys know, that this cost is very burdensome, as while we get some equipment donated to the program, which is fantastic, that families are able to donate that equipment. We do spend a lot of budget too, not only on the storage, the delivery, but buying new equipment as well to make sure that our families in the state of Texas have the resources and the best quality equipment possible. And so as we continue to build and expand this program, fundraising, the resources needed to make that happen come through fundraising just like this. And so you guys will see upcoming emails about that program and about how you guys can help invest into that as well and help grow that program in the state of Texas. So again, a big, huge thank you to the Ildebrando family for putting up that match for our campaign this year to help supplement and build and continue to grow our DME program. So big, huge thank you to them. And so Tanya, I will give it back to you.
There we go. Thank you, Tanner. We appreciate it. And thank you all for joining us today. Again, as Tanner mentioned, we can only have this impact because of the generous support of our donors and partners. And so we appreciate everyone greatly for making this community as strong as it is. We have some really good events still coming up. We've got summer events coming up, fall events. Go ahead and save the date and mark your calendars now. So we have Under Blue Skies coming up, y'all. That is coming up May 13th. That's the virtual Blue Skies party. Lou Gehrig Day is June 2nd in Houston with the Astros and June 4th in DFW with the Texas Rangers. We're still waiting on information and details from both ball clubs and organizations. As soon as we have more information, we will get that out to you. We have, as Tanner mentioned, later this summer, the clinic panel discussion. And then in the fall, we'll have a really in-depth look at our research. And October 30th is the Walk to Defeat ALS. So all kinds of good stuff coming up. Mark your calendars, save the date. Know that you can always go to alstexas.org for all of the events that we have coming up, information, who to contact, and you can reach out to us at any time. We thank you for your continued support. We love this community. We're proud of this community, and we couldn't do it without you all. Have a wonderful rest of your day.